Thank you very much. Colleagues, the next item of business is going to be a statement on novel coronavirus COVID-19 update. The First Minister will make a brief statement, followed by the Cabinet Secretary for Health and Sport, and the whole Cabinet will then take questions at the end of the statement. I would urge members who wish to ask a question of any of our ministers to press their request to speak buttons. And I call on the First Minister, Nicola Sturgeon.
We'll shortly hand over to the Health Secretary, and following her statement, the whole Cabinet is available for questions. First, though, with your permission, I do want to make a brief statement. Scotland today, like countries across the world, faces an unprecedented challenge. Addressing it will involve the biggest peacetime mission our nation has undertaken in our lifetimes. The scientific advice that all 4 governments in the UK received yesterday shows that we are now on the cusp of a rapid escalation in the spread of COVID-19. That means that we must take far more stringent steps to suppress as far as we can the spread of the virus, protect and scale up the capacity of the NHS as best we can, and by doing these things, save lives. The steps we recommended yesterday represent a major change for all of us, a change from life as we know it, but they are essential to give us the best chance of achieving those aims. Let me summarise the 3 new recommendations that applied to Scotland as of yesterday. We had already made clear that if someone has symptoms of COVID-19, a persistent cough or a fever, they should isolate themselves for 7 days. That means, as far as possible, they should not leave the house and reduce contact with other people in the house as much as possible. In addition, and this was a new element in yesterday's advice, anyone else in a household where someone has symptoms should isolate for 14 days. That covers the 7 days for which the first person is infectious and a further 7 days to see if they or anyone else gets the virus. These measures are essential to reduce the chance of spreading the virus to others. The second measure, which applies to everyone, not just to people with symptoms, is that we should minimise social contact as much as possible. This is vital to reduce the risk for all of us of getting infected, or if we do, of passing it on to others, especially to those who are most vulnerable. People should, as far as possible, avoid crowded areas and gatherings. That includes bars, restaurants and cinemas. We also want people to use public transport as little as possible and to work from home if you can. This advice is important for everyone, but it applies especially strongly to 3 groups. Firstly, people who are over 70. Second, people with underlying health conditions for which they get the flu vaccine. And third, women who are pregnant. We are strongly advising them to stay at home as much as possible and to significantly reduce unnecessary social contact. We are not so far proposing the blanket closure of schools. At present, our judgment is that the negative consequences of this for the overall well-being of children and in terms of the impact on the health service workforce, for example, outweigh the benefits. But I do want to assure the public that this is under daily review and the protection of children will always be our priority. The third and final step is to shield the most vulnerable, by which I mean specifically people with compromised immune systems. GPs and other healthcare professionals will be contacting these patients to ensure that they are fully supported. As well as trying to reduce the peak of the virus, we are increasing the capacity of our health service. The Cabinet Secretary will speak in detail about that in a few moments. But I want to restate my heartfelt thanks to everyone who works in our health and social care services. They are dealing with pressures which are already great and which will soon become immense. We will do everything possible to support them. I am also acutely aware of how serious the impact of yesterday's recommendations will be for businesses and for households. The actions we require to take to mitigate a health emergency will for many businesses and individuals cause an economic emergency. We have already announced some support for business and we are urgently considering what more we can do. We're also speaking to the UK Government about what more they will do for business and we will set out further actions as soon as possible. We will also be making more information available in coming days on support for those individuals in financial difficulty. There is, of course, a fundamental principle here which in many ways goes to the heart of the contract between government and people. We as a government are asking people to take unprecedented actions and I recognise that the response from government must also be unprecedented. Presiding Officer, the next weeks and possibly months will be immensely difficult. I know that for everyone this is a deeply anxious time. People want to do the right thing to protect their own health, and they also want to do the right thing for their loved ones and for their wider community. The advice we issued yesterday is intended to help all of us do that. The steps we are recommending: isolating yourself if you or people you live with show symptoms, minimising social contact, washing hands for 20 seconds, not touching your face. All of these things really matter. By following them, we will all be helping to save lives. We face a shared national challenge, and we will need a collective national endeavour to meet it. We all have a part to play. We must all show solidarity, compassion and kindness for each other, not simply in person, but in our phone calls and text messages, our social media presence, even our waves across the street to each other, and also, of course, in our offers to help where we can. And by doing that, by looking after ourselves, our loved ones and our communities, we can and we will get through this. So I want to end, Presiding Officer, by thanking everyone across our country in advance for their help and support in the months ahead in doing just that.
Thank you, First Minister. And can I call on the Cabinet Secretary for Health, Jean Freeman.
Thank you very much, Presiding Officer. Presiding Officer, before I start, can I take this opportunity to apologise my colleagues, the party spokespeople on health, for the very late arrival of this statement. I'm sure they understand how we are working at pace, but that is not normal practice, and I am sorry they've not had any sufficient time in detail to consider it. I am, of course, very happy to answer questions either today or at a future occasion for them. Presiding Officer, our nation faces a challenge to our way of life, to public health, in a manner that has never been seen before in our lifetimes. The scale of the challenge is, as the First Minister has said, quite simply, without precedent. With the First Minister, I cannot express how grateful I am to the women and men of our health service, our care services and our emergency services for all the work they have done so far in addressing this challenge and for the work they are prepared to do in the weeks ahead. They truly are the best of us, and I know the whole Chamber will want to join me in recognising them as we confront the impact of COVID-19 on Scotland. They are our front line and they face a heroic and difficult task, but we can all play our part to help them. As of 9 a.m. this morning, there have been 195 positive cases recorded in Scotland, but we know the true figure of infections will be substantially higher. I also regretfully advise the Chamber that there have now, to date, been 2 reported deaths of patients who have tested positive for COVID-19 in Scotland. Our thoughts are with their families and their loved ones at what is a painful time for them. As the First Minister has just set out, we are asking our society to take some truly unprecedented steps to suppress the spread of this infection and minimise its impact. Forgive me. It's okay. Thank you. Our goal is simple: to protect and save lives, and we need everyone's help to achieve this. I know we've asked a lot of the people of Scotland, but in the weeks and months to come, we may have to ask for far more. To respond to COVID-19 requires a swift and radical change in the way our NHS does its work. It is nothing short of the most rapid reconfiguration of our health service in its 71-year history. That's why today, under Section 1 and Section 78 of the National Health Service Scotland Act 1978, I am formally placing our National Health Service on an emergency footing for at least the next 3 months. I am giving my instructions to NHS Scotland and the individual health boards to do all that is necessary to be ready to face a substantial and sustained increase in the cases of COVID-19. Should I require to lay new regulations to enable our boards to achieve this, I will bring them before this Parliament swiftly. Our first goal is to double the ICU capacity in Scotland. Boards are working towards this by providing the necessary training for staff and by repurposing facilities. Our contingency planning for the supply of oxygen, both in hospital and in the community, is in place, and we have ordered a further 450 new standard concentrators for the use in the community, as well as further contingency, which can be called on if necessary. Our current bed capacity in NHS Scotland is approximately 13,000. Our boards are taking all necessary steps to increase this by at least a further 3,000. To achieve this, our normal programme of non-urgent elective operations will be suspended. I want to be very clear, though. Vital cancer treatments, emergency, maternity and urgent care will continue. NHS boards are aware that they must take a structured approach around postponing of non-urgent elective procedures, with a view that patients will remain on the waiting list until it is clinically appropriate to have their procedure undertaken. All boards are developing local mobilisation plans to achieve this. Additionally, we have established a National Cancer Treatment Response Group, which will provide ongoing advice and support around cancer treatments. The impact of COVID-19 on cancer patients has been a priority in all of our planning, and we will ensure that all appropriate measures are undertaken in the present situation to protect those living with cancer. We are also working closely with COSLA and the Health and Social Care Partnerships and Chief Officers to see a rapid reduction in delayed discharges. The goal I have set is a reduction of at least 400 by the end of this month. We are also engaged with the independent healthcare sector in Scotland, which is relatively small, to ensure that we can utilise them to maximum available bed capacity to help the NHS. All of these steps will necessitate some redeployment of staff within our health service. We have issued guidance to health boards and staff on planning and redeployment. We will keep these under review regularly with updates and advice as the situation evolves. We are also seeking support to backfill, including by working with regulators to enable returners to the healthcare of professionals, and by looking to deploy senior students in both nursing, allied health professions and medicine into settings appropriate to their skills. In addition, NHS Education for Scotland will be providing a range of induction and training materials on COVID-19 to meet the needs of employers, and these can be accessed via the NHS website Tourist Learn, which goes live today. As we work to suppress this infection, we will continue a strong testing regime that will ensure key workers, such as frontline NHS staff, will be tested so that they do not self-isolate unnecessarily. As the First Minister said earlier this week, we are scaling up of COVID-19 surveillance testing, which will give us a more accurate picture of how the infection is spreading in certain areas. This will help direct where we can best place resources to try and save lives. The surveillance will be increased fivefold to give an accurate overview of an area with a population of around 1.2 million. Monitoring will also continue through our laboratories and will be targeted on the following further groups: admissions to hospital, admissions to intensive care, and community testing dependent on circumstances, for example, specific situations such as a nursing home outbreak. The safety and well-being of our hard-working NHS staff is a huge priority, and I expect all boards to ensure that staff dealing with COVID-19 cases have the appropriate training and personal protective equipment to ensure their safety. It is not just, though, in acute setting that support is required. Health Protection Scotland COVID-19 guidance on PPE for primary care states that for all consultations for acute respiratory infection or influenza-like illness, GPs need to wear face masks, aprons, gloves and eye protection. Last week, we issued further supplies of all of these items to health boards for onward distribution to GP practices in Scotland. Should there be practices that require further equipment that is in keeping with the guidance, we will work to ensure it is swiftly delivered by boards, and I have asked boards to ensure this distribution by the 20th of March. In order to cope with rapid increase in numbers of people presenting with respiratory symptoms in this current phase of infection, a new COVID-19 community pathway model is being implemented, with patients being asked to contact via NHS 24 on the 111 number rather than through their GPs. We are also ready to support local authorities and care providers with supply issues relating to PPE for social care sector in order to safeguard vulnerable people in our communities. Extensive work is already underway with our social care partners to put in place arrangements to increase the social care workforce capacity. One group that could be profoundly hurt by a COVID-19 infection is people who are immunosuppressed. If you are in this category, next week the NHS will directly contact you and advise you of the stringent measures you need to take to keep yourself and others safe. NHS Scotland will make those contacts directly next week and work closely with other social services to ensure that support is provided. For those in long-term care facilities who are often frail with complex needs, HPS has published specific guidance for infection prevention and control in social or community care and residential settings. In addition, the Chief Medical Officer has published specific advice about visitors and admissions to care homes. We are discussing with Scottish Care and COSLA what more can be done to ensure the overall well-being of residents in long-term care homes, and we are engaging with third sector partners who have contact with and already support those who are clinically vulnerable to ensure people receive the right advice on what precautions to take, and that those supporting them also have the best information available on how to keep people safe. Presiding Officer, in years to come, when people look back, there will be a time before this infection outbreak and a time after. It is a watershed moment in our nation, in our world, and most certainly in our NHS. We are doing and will continue to do everything we can to protect and save lives. But this is going to take everyone. We all have a responsibility and we need everyone's help. Thank you.
Thank you very much, Cabinet Secretary. And now the whole Cabinet is here and will take questions depending on the nature of the subject that is raised by the members. And I think the First Minister will sort of coordinate with our colleagues, sort of. Yes. Well, shall we take it? Shall we start and see how we get on here? So I'm going to start with Jackson Carlo.
Thank you, Presiding Officer. Just a fortnight ago, I made clear that Scottish Conservatives would offer our full support to the First Minister and our Government as they respond to the coronavirus emergency. I didn't do that lightly. 10 years ago, I shadowed Nicola Sturgeon as Health Minister when she led the national response to a previous epidemic. And whatever political differences we might otherwise have, and God knows they are many, I have every confidence in her to lead the country's response to this crisis at this time. Presiding Officer, let me say clearly, this is not the time for opposition parties to exploit our situation or to use partisan and pejorative rhetoric against the efforts being made. To those venting against the UK Government, or directly to me about Sturgeon's government, let me be very clear. For now, this is a government for all of us, just as the government at Westminster is a government for all of us. Will mistakes be made? Possibly. Will our response at times be slower than we would wish? Probably. And after this is all over, we can learn from our experience and prepare ourselves for any future event. But for now, I am clear that Scottish Conservatives will stand with the First Minister and assure her that the questions we will ask will be measured and entirely designed to inform and not to hinder the national effort she is leading, and that we all place our trust in the advice we receive from qualified professionals. We are, as both the Prime Minister and the First Minister have said, all in this together, and this party in this Parliament will stand together with the Scottish Government. And may I ask the Cabinet Secretary for Health a question regarding those in receipt of home care support? I, like I imagine other MSPs did, received calls yesterday, not from emergency or support services wondering whether they might infect somebody who was receiving support, but from somebody receiving support who thought they might now have symptoms and who had found that their entire care package had therefore been removed as a consequence. Obviously, many of these people will absolutely depend on that service being sustained, and they are in urgent need of advice as to what they should do, as may well be those directing the teams that would normally support them.
Can I call on the First Minister to respond first?
I will hand over to the Health Secretary on the specific question. Can I take the opportunity to respond to Jackson Carlow and to thank him for those comments? Like many of us in this chamber, I am a politician to my fingertips, but I have never been less interested in party politics than I am right now. In the battle against this virus and what we face in the months to come, we are all on the same side, and we should never ever forget that. I accept and understand the importance of robust scrutiny, and I think that is important now as it is at all times. But we are in a common endeavour, and I think it's important that we recognise that. We have never faced a situation like this, so I will do something else that is perhaps not normal for a politician. I will candidly say we will make mistakes. We will not always get this right, but we will strive at every turn to do the right thing for the best reasons and in good faith. And I genuinely appreciate the sentiments of support that Jackson Carlow has articulated today. And I'll hand over to the Health Secretary on the specific question.
Jean Freeman.
I'm grateful to Mr Carlow. That is a disturbing situation that you have described to me, and I would be very grateful to know the detail of that. Home care support should not be removed in circumstances where people feel that they have the symptoms, that dry cough or the fever, or indeed any other illness that they then want to receive clinical care for. And I will absolutely follow that up as soon as we are finished in the chamber today, if I have the details of that from you. And tomorrow I am meeting my counterpart in terms of political leadership, Councillor Curry from COSLA. I know I will speak to him later today and ensure that through our local authorities who either provide home care support or contract for home care support, that message is delivered loud and clear. We must ensure that the people who need the support receive it, those who need additional support receive it, and where clinical or medical attention is needed, they get that as quickly as possible.
Thank you. Richard Leonard.
Presiding Officer, can I also thank the First Minister and the Cabinet Secretary for Health for not only their statement today, but their cross-party cooperative approach to this huge challenge that we face. This is a fight for all of us regardless of party, and we can only do it if we work together, stand as one, and stand together with humility in the face of this great challenge. A few days ago, the head of the World Health Organization said, in his words, it is not possible to fight a fire blindfolded, and that social distancing and hand washing alone will not extinguish the epidemic. We have a simple test for all countries, he said. A simple message for all countries. He said, test, test, test. Test every suspected case. He said that the most effective way to prevent infections and so save lives was breaking the chains of transmission. That we should find and test every suspected coronavirus case, not just those in hospital. That we need to track and trace on the grounds that we can't fight a virus if we don't know where it is. So we welcome the Scottish Government's announcement of surveillance testing for COVID-19, its expansion to monitor the spread of the virus in the community. However, the inference of that is it is clear that not everyone will be tested. So what assurance can the First Minister and her Cabinet Secretary for Health give to those patients who suspect they have the virus but are anxious about the news that they may not be tested? And can we also be given more information about this proposed expansion? When will it begin? And where will the 200 testing practices be?
First Minister.
Can I thank Richard Leonard again for his offer of support? It is genuinely appreciated. I will address the point about testing. Can I say, first of all, and this was a lesson I learned during the swine flu pandemic, we must listen to the WHO, the World Health Organization, and experts and be guided and informed by their views. So I take that very seriously. On the issue of testing, we are right now asking everyone across our country who displays symptoms of coronavirus, a fever or a persistent cough to stay at home, to self-isolate. If we, as we move into this next phase, were to test absolutely everyone, we would require significant resource that I think should be spent caring for people to take tests, to get test results back to them. And then the advice we would be giving them if they were testing positive would be exactly the same as the advice we are giving them anyway, which is to stay at home. What we will be doing, though, and we are not dealing with this blindfold in any way, we have to understand much better than we do to date how this virus is spreading and the way in which it is behaving. That is why the community testing we have outlined is so important. So in summary, we are expanding what we call our GP Sentinel testing, which currently, in normal years, most of us don't pay much attention to this, which we normally publish figures from during the flu season, because that's how we monitor the flu season. Right now, 41 practices across the country, covering around 250,000 people, are involved in that programme. We are in the process right now of expanding that, so it will be expanded to cover 200 practices, which are a representative sample of the country, and they collectively cover a population of 1.2 million people. In addition, and that will allow us to have much better information about how this virus is behaving, how it is spreading, than we do from the figures we are currently publishing. This is a counterintuitive point, but those figures right now are an underestimate and don't allow us to have this level of detail. We will also continue to test everybody in hospital who has symptoms of respiratory illness or flu-like symptoms or symptoms of coronavirus. And crucially, and this is a point in Scotland I think is really important, we are going to continue to test key workers, because we do not want... Crucially, and this is a point in Scotland I think is really important, we are going to continue to test key workers, because we do not want frontline health staff self-isolating unnecessarily. Do not rule out expanding that further if that can help us in the fight against this virus. I hope that information is helpful, and I'm happy to continue to provide further information if we build on that further in the times ahead.
Alison Johnson.
Thank you. Thank you, First Minister, for your statement, and to the Cabinet Secretary too, and the Scottish Green Party wholeheartedly associate themselves with colleagues' comments. We will work together cross-party. As I suggested last week, as I raised last week, it's absolutely essential that no one loses their home at this time. So I'd like to better understand what steps the Scottish Government are taking to deliver an amnesty from rent arrears and mortgage payments to ensure that not one person or family loses their home as a result of their inability to work at this time. So can the Government confirm that a no evictions policy will be applied and that the steps taken to support this policy will be supported?
First Minister.
Can I thank Alison Johnson for her supportive comments. What she has outlined is absolutely what we want to seek to deliver. There will be more announcements on this in the days to come, but I'm going to ask Aileen Campbell to give a brief summary of the work we're involved in right now.
Aileen Campbell.
Yeah, absolutely, and I'll be able to...
And Ms Campbell, could you just...
Sorry, okay, I'll be able to outline some more details on Thursday at the statement, but certainly I think the point that you make is a good one. So it's not just the medical response, the science driven by the science, it's also about the need for us to tackle other vulnerabilities, and of course finances will be one of them, and of course people's ability to pay their rent. So absolutely, the Housing Minister is already actively engaged in much of that work. We're looking to ensure that we can protect those who will face rent arrears potentially if they have no income, to make sure that they can keep their home, and to make sure that everyone understands, everybody, whether that's registered social landlords or local authorities, that we can't make and compound this situation and make it any worse. So we're absolutely working with partners to ensure resilience is there on those other and broader social situations that Alison Johnson has outlined. We'll be able to furnish her with more information when we make the statement on Thursday.
And Willie Rennie.
I think to be frank, we're all afraid, but I am comforted by the fact that the First Minister has taken such a professional approach to this whole period. And I think that gives us confidence in this chamber that all that can be done is being done. And that's why I'm saying to everyone, even those who have got doubts, they need to listen to the First Minister and our excellent advisers. That would be the best thing for them to do and for their loved ones. I spoke to many businesses and people yesterday, and they are afraid about getting food on the table, about having a roof over their heads and about whether their businesses are going to continue through this. We do need a massive programme of investment, and I hope the Chancellor this afternoon is setting that out, and I hope he does. But what steps does the Government think is going to be necessary to make sure these businesses continue? That, as Alison Johnson says, that the mortgages and the rents are being paid for, but also, most importantly, they have food on the table as well.
Can I thank Willie Rennie for his comments? Can I also take this opportunity to put on record my gratitude, and I know I speak on behalf of the Health Secretary, to our advisers, in particular the Chief Medical Officer, the Deputy Chief Medical Officer, all of the officials and experts who are advising us. They are also facing an incredibly challenging situation, and I am grateful every day for the advice and expertise of experts and officials, but I've never been more grateful for it than I have been in the last few days. I'm going to ask Fiona Hislop to answer the questions about businesses. The point about individuals, I think Aileen Campbell has already addressed, and there will be more information on that later this week, but I'll hand over to Fiona Hislop.
Fiona Hislop. So this is primarily absolutely a health issue, but the impact on the economy will be significant. And therefore how we respond and how we work with the UK Government will be important. Kate Forbes is speaking to the Chief Secretary of the Treasury this afternoon. I'm speaking to the UK Secretary of State for Business this afternoon, and we will be encouraging them and urging them to use every lever they have to ensure that we can make sure that businesses stay in business, that employment can continue where at all possible, that we keep productive capacity so there are jobs for people to return to. Obviously, there are issues around making sure that there is enough payment for statutory sick pay, etc. from day one, as has been announced. I have met already with the business organisations and the SCUC. Indeed, many of the issues that are addressed can be supported by the Scottish Government, but absolutely this needs a global and also a UK-wide response in terms of the economic impact that this will have. So we'll be encouraging the UK Government to use every lever they can to do so. Part of that is making sure the banks deliver and support. The banks already, over a number of areas, are dealing with loan repayment deferrals. A whole variety of different steps have been taken. But I would say this, that in recent times, the country has supported the banks. It's now time for the banks to support the country.
Thank you. Members will not be surprised to hear there is an unprecedented level of interest from colleagues to ask questions today. We'll try to get through as many as possible. Could I ask, I'm going to call Angela Constance first, before by Miles Briggs. Could I ask members, when they are asking a question, maybe to begin by indicating which Cabinet Secretary or Minister they would like, to whom they are addressing the question. The First Minister will be able to respond to many, but if you actually know which Minister or which Ministry, which Department you're addressing, then please say so. Angela Constance.
Thank you, Presiding Officer. And the Cabinet Secretary for Health will be aware that across our communities and indeed in the media there is much discussion about the scientific advice both at home and abroad and how this informs the restrictions placed upon our daily lives. Therefore, I would be very grateful if the Cabinet Secretary could provide her assurances that the steps the Government is taking to protect us all is based on the best possible scientific advice, and perhaps she could explain how this advice is tested and scrutinised.
Jean Freeman.
I'm grateful to Ms Constance for her question. So the scientific advice that comes to us in a number of ways, primarily through the Scientific Advisory Group for Emergencies. It has below it, or working alongside it, feeding into it, another group. Now, these are individuals who are drawn from a range of particular specialisms from across the UK, including from here in Scotland. They are looking at the data from elsewhere in the world. They are modelling what that data, constantly modelling what that data tells us about the nature of the virus, the biology of how we would expect it to affect individuals, the way in which it is spreading, and the efficacy of different sets of measures that need to be introduced in order to delay its spread, manage it, suppress the peak and allow us to treat those who would be most impacted. And of course, that scientific and clinical advice comes to us as well, identifying the groups of people who are most likely to be impacted in a serious way by this particular virus. The other point I would make, of course, is that we have our own advisors, our Chief Medical Officer, our Deputy Chief Medical Officer and others the First Minister has mentioned, and they are engaged in all of that work and in scrutinising that work. The final point I would make, though, is this, and that is that neither the First Minister nor I, nor to the best of my knowledge, any of my Cabinet colleagues are clinicians. We are not scientists. And so our scrutiny and our challenge to what is being brought to us and proposed to us is critical in order to ensure that we have the confidence in order to take the decisions that we take, including those that we took yesterday, in order to get to the situation which we want to get to, where we protect the most vulnerable and we save as many lives as we can.
Miles Briggs, be followed by Monica Lennon.
Thank you, Presiding Officer. This is a question for the Health Secretary, but goes beyond the Health Service as well, specifically with regard to clarity around the rapid testing system. NHS and social care staff are clearly keen to get back to work if they can possibly test and see whether or not they're able to do that. Oil and gas workers are also concerned in terms of going out to rigs and the destabilisation of the energy industry. Could I ask what steps are being taken, therefore, to plan and extend a rapid testing across Scotland?
So that work is currently underway. There are a number of critical what I would call frontline workers in our emergency services more broadly, not simply the health service. Now, we need to be careful and considered here in who we identify in those areas, but it does stretch to some of our other critical infrastructure sectors. So the work is underway to ensure that we can rapidly test, produce the results and allow people, if they do not have the virus, to safely return to work. And my colleagues across the Cabinet will be feeding into me who else they believe from their respective sectors would qualify as a critical frontline worker, that we can ensure that the steps are taken so that they can be included in that.
Monica Lennon, to be followed by Bruce Crawford.
Thank you, Presiding Officer, and I welcome the update from the Health Secretary that health boards have received additional supplies of personal protective equipment, and I have no doubt that that will continue. But can I raise a very immediate challenge that has been raised on behalf of Scottish Ambulance Service staff by GMB Scotland, who I know wrote to the First Minister on Friday. They are very concerned about the lack of PPE amongst crews, and when they wrote on Friday, that was because a paramedic who had been sent to a suspected COVID-19 patient without PPE was later confirmed, both them and the patient confirmed as having the virus. So staff are naturally very concerned and worried. What immediate steps are being taken to reassure Scottish Ambulance Service staff and to ensure they get the vital PPE that they need?
Jean Freeman.
So the ambulance service has already distributed supplies to about a third of those in their workforce who require it, and the training, and are working their way to ensure that all relevant ambulance personnel receive particularly that face-fit mask and the other protective equipment that they need in order to ensure that they rapidly have covered all of the relevant paramedic and other ambulance staff. So they are about a third of the way through that exercise, continuing to do that exercise. They are looking at different ways by which they can do it. So, for example, at Ninewells Hospital, they have deployed one of their members on the basis that most of the crews will eventually get to them there at that A&E. And as they come in with relevant patients and hand over, they then very quickly go and get that face mask fitted so that they are then ready for the training and we can move it along as quickly as possible. So I want to assure Ms Lennon that the ambulance service is taking this very seriously indeed. They've already got their plans in place and they are working through that. And of course, we are monitoring that very closely to make sure that they meet the timescales that we need them to meet.
Bruce Crawford, to be followed by Jamie Green.
Thank you, Presiding Officer. My question is for John Swinney, the Cabinet Secretary for Education and Skills. I've received Cabinet Secretary representations from a number of constituents, I guess you will have too, about the potential closure of schools. If schools are not to close at this stage, I'm also being asked what's been done to provide guidance to education authorities, schools and concerned parents about whether children with significant respiratory conditions should be removed from school in order to protect them from potential harm.
John Swinney.
President Officer, I entirely acknowledge the concerns that Mr Crawford has raised, and I have heard many of them from members of the public around the country, as has the First Minister, and the First Minister has addressed many of these issues in the remarks that she has made. Quite clearly, there is an evolving situation, and yesterday, when the steps and recommendations about social distancing were set out, particularly about those with particularly challenged health circumstances, that should apply to school pupils as much as it should apply to any other member of our society. So the guidance in that respect is very clear, that if a young person is in those circumstances, they should not be expected to be at school, and schools should understand and support young people to that extent. On the wider question of school, on the availability of schools, we are clearly in active discussions with our local authority partners, with our professional associations on all of these questions, and as the First Minister said yesterday and again earlier on today, these issues are kept under very active daily review, and we'll have further discussions on these questions in the course of today.
Jamie Green, to be followed by David Stewart.
Thank you, Presiding Officer. Can I carry on in that vein? Further questions for the Education Secretary, who I appreciate is striking a very difficult balance between local autonomy and decision-making versus mandatory nationwide advice to schools. Can I ask some very specific questions? Are parents currently being advised to take children out of school if a whole household needs to self-isolate for 14 days and thereafter those children return to school? Can I ask what further conversations the government may be having with local authorities around how and when those who are in charge of educational settings may take individual decisions to close institutions if they deem it appropriate? And I think there also remains some confusion as to whether teachers who currently fall into a vulnerable group will still have to attend their place of work, especially pregnant teachers and those who have existing health conditions or may present with symptoms.
John Swinney.
Can I thank Mr Green for his points? If I could link his first and his third points together, because my response is essentially the same. Where a pupil is part of a household, then the 14-day requirements apply to that pupil and to that household. And that's based on the general population-wide advice that's being made available. The same applies to members of the teaching profession. If individual members of the teaching profession experience the symptoms of COVID-19, then they should stay at home for 7 days. If they are part of a household, then that creates the 14-day rule for each individual household. And it's no different for teachers and pupils compared to any other member of our country, based on the advice that was issued yesterday. Now, when it comes to the question of school closures and individual decisions, quite clearly the statutory power to run and deliver education at local level is exercised under the Education Scotland Act by a local authority. But we are quite clearly having discussions with local authorities about the whole question of school closures. There was a further discussion this morning between my officials and COSLA and the Association of Directors of Education, and we will have further discussions on these questions in the course of today. What I would say is that individual local authorities have had to take individual school-by-school decisions, a lot of it in Ms Wishart's constituency in Shetland, but there have been other schools, Dunblane High School, Perth High School, Hazelhead Academy, Monroe's Primary School in Angus. A range of schools have given, because of their individual circumstances, Lanark Grammar as well, have had to take those decisions. But system-wide decisions I would want to take on a collaborative basis, and we are taking forward those discussions. I should also place on the record that I had a very helpful conversation this morning with Gavin Williamson, the United Kingdom Secretary of State for Education, who is wrestling with many of the same questions.
Thank you. David Stewart, to be followed by Gillian Martin. David Stewart.
Thank you, Presiding Officer. My question is for the Cabinet Secretary for Health. The Chief Medical Officer for England predicted that nearly all the COVID-19 cases will hit in a heavily concentrated burst 50% in a 3-week period and 90% over 9 weeks. Does the Cabinet Secretary for Health recognise these estimates for Scotland and share the pandemic modelling?
Ian Freeman.
So I do recognise those numbers, but what I need to remind the member of is the aim of the measures that were announced yesterday. And that aim is to bring down those numbers as low as we possibly can over a long period. This is not a short-term exercise at all, and to do that in a way that will allow our National Health Service to manage those who require their particular treatment. Now, we have done that modelling across the UK, so our modelling on how we can scale up the NHS in Scotland matches what they are also anticipating they can do south of the border and elsewhere. And now these particular steps, partly to enable that increased capacity to meet the demand, but also at this point, remember we always said these measures were in the mix. It was about taking them at the right time to secure maximum impact. And we have judged now on the basis of that scientific and clinical evidence that this is the right time to take them as we begin to see an increase in case numbers.
Gillian Martin, to be followed by Rachel Hamilton.
Thank you, Presiding Officer. My question is for Fiona Hislop, Cabinet Secretary for Economy and Fair Work. Like many colleagues, I've had calls from business owners who are concerned that their insurers will not cover them if they're required to close for a period as a result of COVID-19. This could see businesses forced to close permanently and staff unnecessarily laid off and without income. Can the Cabinet Secretary advise what steps have been taken to support businesses and their employees facing this worrying situation? And I welcome her comments about what she said about the banks. What is her response to the information just given her around insurers?
Fiona Hislop.
As we stand just now, there are no powers for the government to close pubs, restaurants, etc. However, the emergency legislation that is currently being prepared and being presented to the UK, it's the UK emergency legislation, there is a role for this Parliament in that, will provide those powers. That will help and resolve issues for some companies and businesses that have insurances that would depend on government instructing that. I'm acutely aware of the immediate issues that are facing many tourism and hospitality, pubs and restaurant businesses, and we are quite clear that those powers are needed, and they're needed soon. Perhaps, if possible, the UK could consider bringing forward its timescale, but I will leave that to my colleague, the Parliamentary Secretary, to liaise with the UK Government on that. But that may require this Parliament taking action as well. But those powers are needed before any action like that can be taken. But we're very, very aware of that, and we'll bring that urgently to the attention of the UK Government.
Rachel Hamilton, to be followed by Elaine Smith.
Thank you, Presiding Officer. My question is for the Cabinet Secretary for Communities. Individuals who are self-isolating on statutory sick pay or indeed have just lost their jobs are experiencing huge pressures on their household incomes. What little they have to live on is being prioritised to feed their families and heat their homes. What advice is the Scottish Government giving to local authorities to help residents who cannot pay their council tax bills or indeed may need further financial help?
Aileen Campbell.
Thank you. And we're working very closely with our partners in local government, working through with them with our local resilience plans, but I'm acutely aware of the scenarios that Rachel Hamilton speaks about that financial vulnerability caused by the response to the COVID-19, and we are currently working on a number of measures to support those that are financially vulnerable. That will include looking at increased Scottish Welfare Fund support for renters, as I outlined to Alison Johnson, looking at ways in which we can support people who may be fuel poor or unable to heat their homes, working with energy companies, and also looking to respond to food insecurity issues as well. We've already worked quite closely in preparation for Brexit with FareShare, so we have existing good contacts and good networks there. And in addition to that, we're not ruling out the need for us to purchase food as well. So there's a number of areas that we're working through because of that financial vulnerability that people are experiencing to ensure that they don't face hardship. And at its most basic level, we're wanting to make sure that people are kept safe, warm and fed. And that's guiding our actions and our approach, which will be outlined in more detail on Thursday.
Thank you. Elaine Smith, to be followed by Bob Doris.
Thank you, Presiding Officer. I've been asked by a number of student nurses to clarify some issues, so my question is for the Cabinet Secretary for Health. What guarantees will be given to final year nurses who will be needed to work on the front line and offered early registration in relation to crediting the hours worked as placement hours which are needed by their course? What pay band will they be on? Will they receive the normal 2 to 4 week induction period with the necessary extra support before entering a ward? Will they be professionally insured? And who should provide the PPE? Because some hospitals are saying it's the university, and the university is saying that it's the placement providers, so there's a great deal of worry.
Jean Freeman.
Thank you very much. I'm grateful for the question, and I should start by saying I will be grateful to all those final year nursing and midwifery students within 6 months of qualifying who will step forward and assist us in this way. There's about 3,000 individuals. Their engagement will be voluntary on them. We are in discussions today, yesterday and today. We hope finalising it today for a 4-nation agreement with the Nursing and Midwifery Council that will allow that to happen with no detriment to those final year nursing and midwifery students, so that they will be credited for that work and will not be held up in qualifying finally. They will be on a nursing band. I do not have that directly to hand exactly which one it will be, but I'm happy to make sure that Elaine Smith, that I advise her of that. And in terms of PPE, let me just say I have little time for squabbles like this, so I will sort out exactly who will be providing the PPE. It will be the health service, and if we think it should have been the university, we'll have that argument another day. But we will make sure they have it, and they will have the induction necessary.
Bob Doris, to be followed by Gordon Linders. Bob Doris.
Thank you, Presiding Officer. This is for the Cabinet Secretary for Communities. Cabinet Secretary, following a meeting I had this morning with Glasgow North West Citizens Advice and partners, including housing associations and the Trussell Trust, we are mapping out the provision and coordination of matters such as emergency food need and supply, welfare and benefits and energy, particularly relevant for those on prepayment meters. Cabinet Secretary, can I ask how the Scottish Government intends to assist such a community-level response, both in practical terms but also financially, to support trusted community stakeholders who know their communities well and who are prepared to do all they can on the ground to assist at this hugely challenging time?
Aileen Campbell.
Thank you. There's a lot that is really incredibly negative about this situation, but one of the things that has, I think, given us a lot of heart has been the incredible response that we've seen through many of our communities, the desire and need to help those that are most vulnerable in their communities, and the way in which they want to respond to that. So absolutely, that is the kind of work that we want to support financially. You know, this is, as I think either the First Minister or Jean Freeman said, this is an unprecedented situation, requires an unprecedented response, and will require us to move at scale and pace to help those that are most vulnerable. And that will include making sure that we financially support community endeavour, make sure that we also give them the guidance that is necessary to keep their actions safe, to make sure that they keep healthy as well. In response to Rachel Hamilton, I outlined some of the areas that we're looking to do further work on, which includes around fuel poverty, it includes around food insecurity, around working to support people keep their home as well. But that will require us all to work together. That's not just about national government and local government. It absolutely includes that community endeavour, which will be absolutely necessary for us to emerge through this situation. And we'll outline some of the more of the detail around the finances and the numbers on Thursday. But absolutely, if you have also got community organisations you want us to know about, this would be the best time for us to know about it, so that we can direct the resources in the most appropriate way.
Thank you. Gordon Lindhurst, to be followed by Jackie Bailey.
Thank you, Presiding Officer. This is a question for the Cabinet Secretary for Economy, Fair Work and Culture. Cabinet Secretary, self-employed people face particular difficulties at this stage and possibly loss of their livelihoods. Can the Cabinet Secretary provide detail of what help and financial assistance is available to self-employed people in Scotland and how they can quickly and easily access that help and assistance?
Fiona Hislop.
Well, the Scottish Government will do what we can, and indeed in a whole range of areas, particularly in the rates area. My colleague Kate Forbes has set out on Saturday a number of issues to help a number of companies, particularly using the rate system, and she circulated that to members. There are issues particularly around the ability for the self-employed to claim and to get support. The employment assistance system can be in place, I understand, but again, this is DWP, job centre issues. I happen to be in my local job centre on Monday, having that discussion with them as to what was available. So I would say that in terms of what is available to self-employed businesses in particular, some of the measures that the UK Government can bring in, and indeed have brought in to an extent about availability for support, particularly if they're not eligible for statutory sick pay, but they can get ESA. That's another opportunity to help self-employed. But we'll make sure that we communicate what we have and what's available to self-employed, and we will support where we can. But again, this will have to be something that is done together with the UK Government.
Thank you. Jackie Bailey, to be followed by Patrick Harvey.
I know the Cabinet Secretary for Health recognises the important work of social care providers. Can I ask her to work with COSLA to ensure that social care providers are paid for the services they are commissioned to deliver, irrespective of the impact of COVID-19? And as part of that, the Cabinet Secretary will be aware that social care providers base their financial modelling on a 4% sickness absence rate. If they hit absence levels of 20% or more, which is projected, the impact on providers will be significant. Can the Cabinet Secretary turn her attention to this urgently, given the need to sustain social care services?
Jean Freeman.
I'm grateful to Ms Bailey. I want to assure her my attention is already on this. COSLA and I are working very closely together on a range of matters around social care. Social care provision is vital in the best of times, absolutely critical in these times. Not least because there will be increased demand on social care. So we are looking at how we ensure the sustainability and the resilience of that workforce, how we make provision to cope with a greater than normal absence level so that there is no dip in this care that people receive and the packages that they require. And some of that will involve using some of those individuals we've talked about earlier, perhaps those final year nursing students and AHPs and others, working to the level of their competence and not beyond that and supervised appropriately. But we will look at all of those matters. And as I said to Mr Carlow, if any member in this chamber has any specific instances of concern where someone's package has been altered in some way or they feel that they're not receiving the care that they require, then I need to know that in detail and I will act on it as soon as I receive it.
Thank you. Patrick Harvey, to be followed by Beatrice Wishart.
The Scottish Government has had a fair work agenda for a good number of years now, but despite those sincere efforts that have been made, there are still vast numbers of people in Scotland who are enduring poverty, wages, precarious incomes and many forms of workplace exploitation. This crisis is exposing their vulnerability like nothing before, and I'm sure many of us are aware of individuals who are not only losing pay or losing their jobs altogether already, but many who are also reporting that they're being given no choice by their employers but to turn up for work anyway despite having symptoms. Does the Scottish Government recognise that whatever level of support is provided to businesses, it needs to filter through to individuals? Fair work conditions need to be attached. And is the Government also aware that a number of countries are responding to this emergency with policies akin to a universal basic income, and that the case for that direct financial provision to individuals will only grow stronger the longer this situation lasts?
Fiona Hislop.
There are a number of issues in there. Fair work is very important to this government and has been and will continue to be. And indeed, in the statement that was made by my colleague Kate Forbes just on Saturday in relation to business rates, we specifically referred to the Fair Work agenda and the importance of that. Just last Wednesday, I met with the business leaders and the SUC, and fair work was central to that discussion. Because if we're asking people to take tough decisions about their businesses, if we're putting frontline workers in jeopardy in any way, they have to make sure that they're supported. We should make it absolutely clear that everyone, businesses and employees, should be responding to the health advice as to what's acceptable in terms of people who are working. People who are symptomatic should not be in work. And part of that responsibility lies with businesses, and that's exactly the discussion that we had with the business organisations who I'll continue to speak to. But as of now, we're also trying to make sure that businesses stay as businesses, and that means making sure there are jobs for people to go to. We will absolutely pursue that fair work agenda. I will be meeting again with the SUC tomorrow on that issue, but we have to be realistic about where businesses currently find themselves, and keeping people in jobs in the first place is important. Secondly, your point about wage subsidy or universal basic income, that's obviously a wider, probably longer term issue. However, some countries already, we've seen that in Denmark and indeed in other countries, are putting wage subsidy as at the heart. Why is that important? Because at the heart of their response. Why is that important? Because a lot of businesses that are facing crisis just now is because demand has just fallen. These are profitable, well-run, good businesses that in other circumstances would not be needing support. So that's why cash flow is an issue, and the responsibility and the shouldering of that. Yes, I referred to the banks earlier, but also governments can do that as well. We've seen that in other countries, and that's the discussion we can have with the UK government as well.
Thank you. Beatrice Wishart to be followed by Annabel Ewing.
Thank you, Presiding Officer. It's an island-specific question for the Cabinet Secretary for Health. Shetland doesn't have an intensive care unit at the only hospital on the island, so can the Cabinet Secretary provide reassurance that where the medical evacuation of patients with COVID-19 from Shetland and other island groups is required to ICUs on the mainland, that they be carried out safely and efficiently?
Dean Freeman.
Thank you very much. This is a very important question. I know an important one for our island communities. I'm pleased to say that I can confirm that the Scottish Ambulance Service will ensure the transfer of any patient from any of our islands who has a clinical need to do so. One of the issues that had been causing, I think, some concern was around the use of fixed-wing aircraft and the PPE that was required for those who would be both piloting such an aircraft and working with the patient. That has now been resolved. The Scottish Ambulance Service held a conference call with all the chief executives from our Highlands and Islands NHS boards on Friday and produced their specific plan for the retrieval of patients in these circumstances. They have also held discussions with and have set in place the specific plan in terms of use of ferries, if that is appropriate, including road transfer thereafter once the ferry has docked.
Thank you. I'm conscious that the hour we allocated for the statement and questions has been used up. If members are agreeable, I'm going to let this run on for perhaps up to 3:30. That probably still will not get through all the questions we have, but there'll be other opportunities this week to ask questions. Annabel Ewing to be followed by Liam Kerr.
Thank you, Presiding Officer. The question for the Cabinet Secretary for Health. And given the unprecedented position we are all now in, can the Cabinet Secretary advise how the people of Scotland can best access advice on everyday healthcare concerns without putting unnecessary pressures on our frontline services?
Jean Freeman.
The best way, not only in terms of alleviating pressure on our GP services, but also for accurate, reliable and up-to-date information, is the NHS Inform website. And I would encourage everyone, including members in this chamber, to use that website and keep up to date in that way.
Liam Kerr to be followed by Neil Findlay.
Thank you, Presiding Officer. Could the Cabinet Secretary for Justice update Parliament what consideration has been given to any measures required in prisons to ensure that prison staff are sufficiently protected, prisons are operating with sufficient staff, and that prisoners themselves receive adequate health care?
Hamza Youssef.
Can I thank Liam Kerr for that question? The Scottish Prison Service have a national coronavirus response group. They have implemented their pandemic plan. Local governors in charge in the local establishments will oversee those plans. Our concerns, of course, are a number of concerns, but primarily for our staff and those within our care. In terms of staff, we've ensured that Scottish Prison Service have secured sufficient levels of PPE for the next 10 weeks, but of course that level will be kept under review and increased where necessary. In terms of prisoners, we have clinical protocols and guidelines, of course, for the testing of prisoners, but we also want to ensure that we allow the regime to continue as far as possible as business as usual, because we have seen what has happened in other countries, namely in Italy, where there were unfortunately riots which led to some deaths in the prisons, not because there was cases of infection, but because visits, for example, were stopped and leisure activity was stopped, with prisoners in their cells for up to 24 hours at a time. So, of course, where it's necessary, where there's symptoms being displayed, those in our care will be, of course, isolated. But as far as possible within the guidelines, we'll continue to ensure that visits can take place. We'll ensure that activities can continue. And of course, we're working hand in glove with the NHS to provide healthcare within our prisons. We know a number of our prisoners, the majority actually of our prisoners, require medication. So medication stocks, as things stand, are plentiful. But of course, we continue to keep that under review. But I give the Care an absolute assurance the safety of our staff, who do an immense job in our prison service, and those that are in our care, is of course our #1 priority.
Thank you. Neil Findlay, to be followed by Kenneth Gibson.
Can I ask the First Minister to explain a bit further on testing? The World Health Organisation are clear. Their advice is clear to find, isolate and test every case. That did not appear to be the position set out by the First Minister. Given that the World Health Organisation have all the institutional and practical knowledge of dealing with this pandemic and know what works and what doesn't work, would the First Minister explain why we're maybe not following their guidance to the letter?
First Minister.
Presiding Officer, before I do so, can I explain that Fiona Hislop has just left? She has the call that she mentioned earlier with the UK Secretary of State due to take place at 3:15. So if there are further questions from her, Kate Forbes or I will pick those up. Can I say to Neil Findlay, this is an issue that I have taken great care to understand the advice that's coming to me, and will continue to do so, because I understand the importance. An issue that I have taken great care to understand the advice that's coming to me, and will continue to do so, because I understand the importance of having a person that was displaying symptoms. Because we are asking them to stay at home, it would involve such a magnitude of resource that we would take resource away from other parts of the health service where people need that. And crucially, if somebody was self-isolating, testing positive, then the advice that they would be getting would not change in any way from the advice they're getting right now. Now, I will continue to interrogate that position. I don't know what's happening in other countries, but I consider what that would require here to test every single person that has any symptoms of coronavirus. And I simply have a doubt in my mind about whether that is happening in other countries in exactly that way. But I do know how important it is that we have much better information than we have from the figures we've been publishing so far to know how this virus is progressing. That's why the surveillance testing is so important. We must make sure that we do everything we can to protect the resilience of our key workers, National Health Service in particular, social care, but also critical infrastructure, which is why we are intent on testing people in those categories. And I do think we have to continue to consider whether there is further expansion beyond that. One of the things that there has been discussion around is to look at how we develop much quicker testing, or almost testing that could be used by individuals themselves, to give an individual clarity about whether they had the illness or not, and then enable them perhaps to go back to work. So I would say to Neil Findlay, I treat all of these things really seriously, and I understand the concern people have about an apparent discrepancy between the strictness of what the WHO are saying and what we are doing in practice. I just want to reassure him and the Chamber that there is a great deal of care and thought going into what we are doing to make sure it is meeting all the needs that we have around this, and my mind is certainly open, and I will continue to interrogate this position in terms of what we might do beyond the systems that we have put in place.
Gibson, to be followed by Brian Whittle.
Thank you, Presiding Officer. My question is to Fergus Ewing, the Rural Economy Secretary. Today I was contacted by concerned residents of Cumbria. Some 30% of the island's 1,400 residents are over 75, and there's only one small store on the island. Mainland supermarkets don't deliver to Cumbria, and Calmac are likely to reduce their services in the weeks ahead. How, therefore, will vulnerable people in Cumbria and other island communities be supplied with food and other essentials at this difficult time?
Fergus Ewing.
Presiding Officer, it's essential that the more remote areas, such as the Isle of Cumbria and Mr Gibson's constituency, do receive equity of supply. In other words, that shops and general stores should continue to receive the supply of food as is received and taken for granted in the cities. And therefore, in that respect, I've had 2 conference calls with major retailers over the past week, I would say they're doing a fantastic job to keep the shelves replenished in the face of huge demand, and I pay tribute to all of the workforce in those shops that are making a sterling effort to serve their customers in difficult circumstances. I have received assurances from each of the national retailers that there will continue to be an equity of supply across Scotland, including the more remote areas. We are also have been working over the past week to ensure that deliveries of goods to shops can be made more flexibly. And the Chief Planner wrote early last week, to each local authority, urging that each local authority allow restrictions on the hours within which goods are permitted to be delivered to stores. And I'm very pleased to say that there has been a terrific response from local authorities to enable that to happen. And finally, drivers' hours are going to, I suspect, become an increasing issue. Obviously, there are, quite appropriately, restrictions. There are discussions with the UK government, with which I've had discussions myself, about to what extent and when drivers' hours should be looked at, precisely to make sure that the question Mr Gibson raises, which applies to many islands in Scotland and many remote communities, can continue to receive basic supplies of food during the coming difficult weeks ahead.
Thank you. Brian Whittle, to be followed by Sarah Boyack.
Thank you, Presiding Officer. Irvine and Troon Cancer Care have been in touch to point out that they are still taking patients to and from the hospital for treatment, as I'm sure is happening across the country. But they are now restricting each transport to one patient per car, where it's usually 3 per car. So their running costs are going to triple to around £10,000 per month. So can I ask the Cabinet Secretary if the Scottish Government are able to commit anything to help meet these additional costs?
Jean Freeman.
So I'm grateful to Mr Whittle for that question. There will be other vital cancer-related third sector organisations across the country who are doing the excellent job that the one in our constituency is doing. I'm very happy to have discussions with those organisations who are taking the precautions that we would advise them to take, but that then comes with an additional cost, and I'm happy to pick that up with that particular organisation. But actually we have a Cancer Coalition Network, and that is another of the groups that I would want to ensure we have their views and any additional asks or concerns that they might have, so that we can address those.
Sarah Boyack, to be followed by Emma Harper.
Thank you, Presiding Officer. It's actually a question for the Cabinet Secretary for Fair Work, so I'm going to have to address it to the Cabinet Secretary for Finance. I've just been made aware of a staff member at a major retailer who's been sent home because she was wearing a scarf to shield her mouth. She's got a child at school and her partner has COPD, so she's concerned about infections. She's been sent home without pay. So I was wondering if the Cabinet Secretary could speak to employers and to retailers to have the discussion so that we can urgently ensure that people have the right protective equipment, so that where it is possible we can see business as usual with both staff and customers protected. This kind of issue, I imagine, is going to be raised in a number of industries. Thank you.
Kate Forbes.
Member for that question. And on the specific case that she mentions, I'd be grateful if she could supply me with further details so that we can look into that further. Because, of course, working very closely with businesses, not just in terms of supporting them, but in making sure that they do protect their workers and ensure that there's appropriate guidance given to workers, because ultimately what we really care about here is protecting workers like we care about protecting the rest of the population.
Thank you. Emma Harper, to be followed by Ruth Davidson.
There's been a massive amount of social media traction or traffic, I should say, with volunteers wishing to help. Will the Scottish Government, and perhaps this might be for Cabinet Secretary Aileen Campbell, will the Scottish Government issue guidance to local authorities about optimal coordination of support, including for volunteers, to help those vulnerable groups and those who are self-isolating?
Aileen Campbell.
We're currently engaging and working with our local authority partners in COSLA and in Solace, particularly around their local resilience plans, but also about how we then take on board the clear need for us to provide guidance to some of the community response and to make sure that we keep them safe and to make sure that we harness that community endeavour and the volunteers that are so eager to play their part in response to this situation that we find ourselves in. We are working closely with a number of other third sector partners, including National Emergencies Trust and British Red Cross, and to make sure that that guidance can be worked on, that we can provide that leadership to enable people to do what they need to in their communities, but also to help us with this large-scale resilience effort that's required.
Thank you. Can I call Ruth Davidson to be followed by Anas Sarwar?
Thank you, Presiding Officer. According to the most recent data, there are 59,640 people in Scotland receiving home care services. Whether that's help with getting in and out of beds, of washing, dressing, feeding or toileting, that's 60,000 of our most vulnerable people, often entirely dependent on visiting care workers. So can I ask the Cabinet Secretary for Health and Social Care what specific contingencies have been put in place to ensure that nobody is left untended when members of care teams have to start self-isolating or have to stop work due to their own care responsibilities?
Jean Freeman.
So, in part, I think we've already covered that, but just to go back over it again, the work we are doing directly and very jointly with COSLA, who, of course, either provide those services directly through local authorities or commission them through contract with private providers, is looking in detail at the workforce planning here in order to ensure resilience for that workforce. That's twofold. That is partly the anticipated level of absence for the reasons that Ms Davidson outlined, but also we anticipate an increased demand in social care as a consequence of some of the other measures that we have introduced. And so that workforce planning is looking at what provision there can be, in part through our local authority chief executives, looking at, as we have done in the health service, looking at what services they could pause and redeploy their own staff, but also looking to see how else we could bring in terms of healthcare assistance work from some of the additional workforce that I spoke about earlier, including those final year students and year 5 medics.
Thank you. Anas Sarwar to be followed by Shona Robertson.
Thank you, Presiding Officer. Can I join others in thanking all our frontline staff and indeed all the thousands of volunteers across the country. But I also want to thank all the expert advisors and officials who are also working round the clock. There will be time when the evidence and the advice conflicts, and that sometimes we will have to have politicians make a judgment call. And we may question that advice and we may question those judgment calls, but what we should never question is that advice and that judgment call is always made with the best of intentions. I raised last week an issue around GP supplies with the First Minister and the Cabinet Secretary, and I'm grateful for their immediate action and the supplies now being provided to GPs across the west of Scotland, in Glasgow, Renfrewshire and Lanarkshire. But GPs have now since then contacted me to say that despite receiving those supplies, they have a concern with the supplies they have received. So, for example, many practices have received the fluid-resistant masks, and a label has been put over the expiry date, showing that the expiry date is actually August 2021. But when those GPs peel off the expiry date, the true expiry date is actually April 2016, 4 years ago. And the manufacturer's published advice says that those supplies can only work for 3 years after production, meaning that they are 7-year-old supplies, but still with a false date put over that. That's obviously raised serious concern amongst GPs. What action and reassurance can the First Minister and the Cabinet Secretary give to those GPs, and what immediate action are they taking to acquire fresh supplies and make sure they're adequately distributed across the country?
Jean Freeman.
I'm grateful to Mr Sarwar for his comments, but also for that particular question. I am aware of this issue. The supplies, I should say, just to be clear, the supplies that have been issued to GPs have been issued according to Health Protection Scotland guidance in terms of the nature of those supplies, the masks, the goggles, the aprons and so on. But in the particular circumstance that he is describing, we are aware of that. We are taking steps with those boards to ensure that there is a resupply and that the situation is not repeated, and that GPs are contacted so that they know that that is underway and can be reassured on that. And as I've said earlier, I think my requirement is that all our GP practices receive the supplies they need, sufficient to their purpose, and that also means in terms of the timescale around those supplies by this Friday, and that I am advised by Monday that that has been done and there are no gaps.
Thank you. Shona Robertson, to be followed by Graham Simpson.
Thank you. Can the Cabinet Secretary for Communities say what action it can take to support households with prepayment meters who, in the event of self-isolation, may be unable to front-load their meters? And what more should the big six energy companies be doing to help their vulnerable customers in this situation?
Aileen Cannon.
Thank you. We are working to ensure households can keep their heating on, and I think the member is right, Shona Robertson is absolutely right. We'll have to look to the energy companies to play their part in this, and that include issues like ensuring that those on prepayment meters are given credit. Licence conditions require all suppliers to be sympathetic to the individual circumstances of those in financial difficulties and the need to prioritise maintaining supply. So we're currently working on methods and ways in which we can keep the heating on for people, but also absolutely we'll be engaging with energy suppliers because they do have an enormous role to play in ensuring that that can happen.
Thank you. Graham Simpson, to be followed by Colin Smith.
Thank you. It's an education question. Could I ask if there are any plans in place to allow final year university students and indeed school pupils to sit their exams?
John Swinney.
These are very, very significant issues that Mr Simpson raises, and obviously at a university level each institution will have to determine how exactly it will handle the accreditation of the learning that has been undertaken by students in their own institution, and the government will have no locus in that respect. In relation to the SQA exam diet, I asked the Scottish Qualifications Authority some weeks ago to provide me with options on what would happen should the exam diet be unable to proceed. And roughly, I would say there are three options that are available to us for the foreseeable future. Firstly, that the exam diet is able to proceed, as is currently the intention, and that is the position of the Scottish Qualifications Authority. Secondly, that the exam diet could be delayed until a later stage in the year, which obviously would cause significant disruption, but we are facing significant disruption. And thirdly, the Scottish Qualifications Authority could undertake some form of accreditation of the learning based on the evidence that they have available to them from a collection of coursework, prelim results and the estimations based on teacher judgment, which are routinely submitted to the Scottish Qualifications Authority. So I know that's not a definitive answer to Mr Simpson, but I can assure him that the contingency planning has been undertaken. We are considering the circumstances that we face, and the current intention is that the exam diet for the SQA examinations will continue as planned to commence on the 27th of April.
Colin Smith, to be followed by Fulton McGregor.
Thank you, President Officer. The Cabinet Secretary for Health will be aware that yesterday the Government's own figures said that the first case in Dumfries and Galloway had been confirmed, but today I understand that, in fact, there are no confirmed cases because that test was inconclusive. But nobody believes there is nobody in that region suffering from coronavirus. Many, however, are self-isolating, either because they have symptoms or because family members have symptoms. Now, most of those won't be tested, but we are told from the Cabinet Secretary earlier that key workers will be. Now, given what the Cabinet Secretary said about the need to redeploy people, potentially, for example, in one local government job into social care, will the Cabinet Secretary ensure that that definition of key worker is not just those people maybe carrying out the task at the moment, but those people who could be redeployed from one department to carry out those tasks, to keep that workforce as strong and as large as we possibly can?
Jean Freeman.
Thank you very much. I want to make 2 points in responding to that question. The point that is made about the false positive test in Dumfries and Galloway and how the community feels about that actually really underlines why our move to community surveillance and the upscaling of that is the right thing to do, notwithstanding the other comments the First Minister made about continuing to press on other areas of testing, because that community surveillance will give us much more robust data about the level of infection in the community, greater than we currently get through only individual testing. So scaling up that surveillance, that community surveillance, will give us much more robust information about the level of infection across our communities. In terms of your point about key worker, yes, we absolutely will make sure that key worker definition is in part around the tasks that have to be completed, not the individuals in them. So if someone is redeployed into an area where that area of work is a key worker's area of work, then that individual, whether it is from our final year nursing students or whether it is a redeployed local authority worker, will be fit under that definition of key worker. And of course, the other area that needs to be assured, and we are taking steps to make sure of that, is that in some instances, in terms of the work to be delivered in social care and elsewhere, then PVG testing is required as well. So all of those steps will be ensured, but we will make sure that the tasks that are undertaken is what will guide us in terms of key worker status.
And Fulton McGregor.
Thank you, Presiding Officer. My question is quite a specific one, probably for the Health Secretary. A constituent contacted me whose son is type 1 diabetic. She's worried about the availability of insulin as the virus outbreak continues. Apparently there has been some rationing in Norway. Is this something the Government has on their radar? And if so, are there any plans in place?
Jean Freeman.
Thank you for that question. Yes, it is. The availability and the supply of medicines is something that we are paying particular attention to. And actually, I'm very grateful to our Chief Pharmacist, Rosemary Parr, who has postponed her retirement in order to continue to lead that work with us and her colleagues. That is very helpful. There are significant connections between our pharmacy work in Scottish Government, the community pharmacies around our country, and the suppliers of medicines and into the UK network, where, of course, in terms of some of these particular matters on supply, the close working that we can have with the UK Government is really important. So we continue to take strong observation about the supply of medicines, to speak with the pharmaceutical companies when that is required, and to ensure that our community pharmacists and our prescribers are aware of alternative steps that they can take whilst we look to resolve any dips in supply around critical medicines.
Thank you very much, and I'm going to draw matters to a close there. Can I thank members and ministers for their understanding? I'm conscious I've eaten into everybody's time. However, there's still just under a dozen members who had further questions. We'll have an opportunity to return to this subject with statements from the Government tomorrow and the next day, and of course at First Minister's questions. We're going to just have a short